and he had an anterior wall MI almost 6 months back in his country. He's 47. He underwent an angioplasty. It was a successful angioplasty, but after the angioplasty, patient started feeling a lot of breathing difficulty, and he was unable to lie flat. So the breathing difficulty was so much. He was evaluated there, and they found that this person is suffering from severe mitral regurgitation. Mitral regurgitation means it's a leakage of a valve which connects the left ventricle to the left atrium, and because his heart pumping was less, he was not found suitable for the mitral valve replacement. This patient was sent to us for another options which we could explore in our country, like mitral clip. So we did his angiogram again, and we found that both the stents are doing absolutely fine. In that situation, we were left with only two options. One option was either we change the valve by a surgery, which would be a high risk patient who has already heart pumping almost 30-35% and severe mitral regurgitation. Another was a mitral clip, which is not readily available and a costly procedure. So before we were going for all those things, we started his treatment. So over a period of 3-4 days, we found significant improvement in the patient condition. We saw that his ejection fraction slightly improved, his MR vanished, and his PA pressures, which were earlier 90 systolic, they also reduced to almost 50. So patient started feeling better. So the message of this story is, at times surgery is not option for each and every patient. These all medical options should be told to the patient very religiously. Similarly, the patient should also focus these medical measures very religiously. So I would conclude this story by saying that the patient, those who have leakages in the valves, poor heart pumping, these patients can be managed to some extent by salt and fluid restriction. Salt restriction means whatever salt is baked should be continued, it should not be discontinued. So this is sometimes poorly conveyed to the patient, that salt restriction means they cut off all the salt. That is not required. Whatever salt is baked should be continued. Whatever table salt, extra salt we add should be discontinued. The fluid restriction is very important. In most of the cases, if you are able to manage less than 1.25 or 1.5 liters fluid in 24 hours, and of course medicines like ACE inhibitors, ARBs, beta blockers, these medicines are wonderful in these cases. Thank you.